Good morning to all you beautiful people. Welcome to the Drive series. Before I get to work, before all hell breaks loose and I go crazy at work. This is Dr. Nick on endocrinology and metabolism. I want to share with you a quick case about a patient that we are doing an expert witness for a case that we've been hired to review by the plaintiff's attorney. So this patient has developed a hip fracture and she's diabetic. We're like, what does this do with diabetes and hip fracture? Well, hold on a second. After careful review of the records, there was voluminous of hundreds of pages, I think probably close to 3,000 pages. After careful review of the records for several hours, it became obvious this patient has had diabetes for many years, but silently she's been having hypoglycemia. Yeah, there it goes, there's your key. Hypoglycemia and diabetes is a very, very bad thing, but no one ever captured it. Why is that? Because they were just following the A1C. The hemoglobin A1C for this patient was really good, actually. It was like somewhere between 5.5 to like 6.2. Of course, let's go back one step. What is the hemoglobin A1C? Hemoglobin A1C is a glycosylated average blood sugar for measurement of diabetes. So to be diabetic, you need an A1C of 6.5% or higher. To be pre-diabetic, you need an A1C of 5.7 to 6.4%. Well, this patient has been diabetic for many years, almost a decade, and has had diabetes drugs for so long. But they've been managing her and everybody's saying she's doing a great job until she fell and broke her hip. This is where the case comes in here. After careful review of the records, she was on medicines called oral sulfonylureas, which cause hypoglycemia. But more importantly, they were just measuring her blood sugar through the once every 3 months hemoglobin A1C, and we're not using a continuous glucose monitor. So this patient, unfortunately, sustained a hypoglycemia episode because you can see she's had multiple recurrent low blood sugars. These multiple recurrent low blood sugars leads to a lower average. And this patient has had silent recurrent hypoglycemias. This hypoglycemia led the patient to become dizzy, confused, altered mental status, weak, and all of a sudden she fell on her hip, on her right hip, and she fractured her right hip. And that is the consequence of poor diabetes management. So my dear patients, if you're a diabetic, you need to make sure you monitor your blood sugar through a continuous glucose monitor, number one. Number two, if you're on drugs like oral sulfonylureas, like glipizide, glyburide, Amaryl, all these drugs, glimepiride, you should not be on these drugs. These drugs are 30 plus years outdated. We have much better drugs. They're designed to lower your blood sugar regardless of what your blood sugar is. So if you're not eating, they'll lower it. If you're fasting, you'll lower it. If you forget to eat, they'll lower your blood sugar. Hence, low blood sugar, exactly what happened to this patient. She forgot to eat. She was having multiple recurrent low blood sugars. And how did I know that? Because she was seeing a cardiologist for this palpitations they could not figure out. And it was happening at nighttime, during the day, and they couldn't find any arrhythmia. They just said she's got unknown palpitations. And then when they carefully evaluated this case, they came up with no answers. And when we looked at this case very carefully, she was having all the classical hypoglycemia symptoms not documented. Once everything else was ruled out, it became clear and evident A1C of 5.7% on a sulfonylurea and a 75-year-old patient. The most probable cause was hypoglycemia, which was never caught and captured. She got dizzy, lightheaded, had palpitations, and she passed out. She fell down and she fractured her hip. Catastrophic. When you fracture your hip, the recovery is a long time. You know, at this age, the biggest problem with these patients who fracture their hip, they wind up getting possibly clots. Clots, yes, exactly. When you fracture your hip, you're more prone to develop clots, and that's a big problem. So you do not want to be on drugs like that. You want to make sure you have a continuous glucose monitor. And if you're older, you do not want to have an A1C that low. A low A1C has shown poor cardiac outcomes too. So you want to keep your A1C. Your A1C can be as low as possible as long as you do not have what? Hypoglycemia. If you have hypoglycemia, means low blood sugar, your doctor needs to back off the drugs, alter the drugs, change the drugs, change your diet to address that. Very, very important. You don't want to be that patient who fractured her hip. Very importantly, okay? I hope that answers your question. Please take away that great message. You don't want fractured hips, because at the worst case scenario is this patient was fortunate that she fell and fractured her hip, and they go face forward and they cracked her skull. then they wind up getting a subdural hematoma. Very, very dangerous. You do not want that. So monitor your blood sugars, take it seriously, because a low blood sugar, in my opinion, is just as bad as a high blood sugar, if not worse, because it causes cognitive and neurological deficits. All right, I hope this answers the question. You guys have a great day. Thank you.